I do appreciate having the chance to come here and talk to you a little bit about our system, especially from the fiscal side of it. But I always think it's important to kind of put in perspective, our states are also different. I mean, you know, that you heard about that when Kim was talking about kind of looking at the different systems, and you can't just compare this 4-star to that 4-star across states. But we're also really different when you look at kind of numbers, right? So I think we're probably a little bit bigger than Delaware. And so when we talk about, you know, number of kids that we serve, it's almost 250,000 children that are in our licensed centers and family child care homes. Of them, 29,000, almost 30,000 are pre-K because they are in licensed programs. And we serve each month around 70,000 children on child care subsidy. Again, those fall within that 250,000 because subsidy is all in licensed programs. We've got about 6,000 programs that we license, centers and homes. Our homes are about 1,600 right now, and probably 8 or 9 years ago, we had 4,000 family child care homes. And you know, I heard some discussion about, you know, the challenge with family child care homes, and we've always licensed our homes, but you know, I think that part of what happened is as we were increasing our standards, you know, homes, you know, providers were like, yeah, I'm not interested. I was doing this because I was taking care of my child, my grandchild, my neighbor, and that wasn't, you know, something that I want to make that investment in. Now, you know, there's always that. Doesn't mean they're not necessarily providing care, but they're no longer within our system. Where I work at the division, we have oversight, you know, kind of similar to Pennsylvania, over licensing, which is our QRIS, over child care subsidy, over pre-K, and then all of the federal dollars that, you know, come down both for quality and for subsidy, of course. So, you know, I think it's just something to really think about. I mean, when I was looking at Delaware's system, it was like, that's really complicated. And from a provider's perspective, it is, well, who do I go to for which thing? And maybe that's not how it works. That is how it works. Okay.
That is how it works.
Yeah. So, you know, we're, I think, fortunate that it is all, I mean, it isn't all. I mean, we do not have early intervention within our programs. The Head Start State Collaboration Office is at the Department of Public Instruction, but it went there when pre-K was there. But about 6 or 7 years ago, pre-K was transferred to us out of public instruction into Health and Human Services, you know, just to really kind of have everybody put together. But we'd like to get Head Start back. You know, I think they fit better with us. But regardless, you know, it's that one agency that can work together on policies and funding without having to go across agencies. Give you a little bit of kind of where our budget goes. So we spend about half of our budget on child care subsidy. And you know, one of the things that, and I think what I'm hearing is things a little bit different. So if this is right, so our quality dollars, you know, federal requirements related to putting the 9%, you know, increasing and the 3% infant toddler quality, we don't use any of that for subsidy within our tiered system. All of that is straight for quality. So whether it is funding teach or now not wages, we have a infant toddler awards, and we have wages separately. You know, whether it's funding our CCR&R system, whether it is funding our coaching and mentoring for our pre-K teachers, all of those come out of our quality dollars. Really kind of activity related, not reimbursement related. We also have a statewide early childhood initiative, Smart Start, that, you know, goes across, you know, family support and health and early education, and that comes through our budget, but then we just send it on to the state agency that is Smart Start. And then some other pieces, regulation of child care, which is our staff, and then NC Pre-K is about $165 million that goes into that program serving those almost 30,000 kids. But subsidy is our largest program. I mean, that is, when we look at funding wise, certainly our licensing is bigger because we've got, that 250,000 kids. But when we look at money, subsidy is the biggest thing that we implement. And I think one thing that we find really beneficial is we pool all of our federal and state dollars together. So while we can separate out, that 300 million comes from the feds, about 79 million is state funded, from the family's perspective or the local DSS perspective who is making that family eligible, they don't know who's paying for it. It is just they get a block of money and that's what they use to spend throughout the year. That is done at the local DSS. They are the ones who are responsible for determining eligibility for families, and then the family chooses where it is, which program it is that they want to go to. But when you think about what are those funds, I mean, we are blending together our TANF dollars, our CCDF, any state funds, and then Smart Start does put in some dollars for subsidy. They all get pooled, and when that child receives services, the system determines which funding stream they should be paid from depending on their eligibility. So we use our state dollars, for example, to pay for children in need of subsidy because of child protective services or child welfare or developmental needs. And if they've put that in as the reason, the system does it and the county doesn't have to worry about it. And we at the state level can then determine, where are we with spending in each of those pots. I don't know if Delaware, how they blend their funds, but to me, the seamlessness, again, from the provider perspective or from the parent perspective, is really critical. And if you, just something for you all to think about, is it re-envisioning what our QRIS is and or re-envisioning how we at the state level do that work. And I'm sure that there's a lot of, things that go along with that. But, having said that here we have all this money going for child care subsidy, the green line represents the number of children served each month. And the blue line, though, is the number of children on a waiting list. Does Delaware have a waiting list for subsidy?
No, we don't.
So, yeah, we have. Now, it does look like we made this incredible drop from, 63,000 kids down to 24,000 kids. But, Becky was talking about IT. It was actually that we were not counting them correctly. So we really don't think we actually had 60,000 kids on the waiting list. It looks like, wow, really North Carolina's made a big difference. But, really the number of kids being served each month, has stayed pretty much the same. We've been focusing a lot recently on infants and toddlers. And what that means if you're, on the waiting list is you're going to be 3 years old before you get served. And so when you think about, equity of access, infants and toddlers are not getting that same access as older children because they may go on the waiting list when they're a baby, but they stay on it for so long. Again, we've got a number of counties that have been able to clear their waiting list, but it's a challenge, and it's how do you balance what you're going to do with your funding. This is the reason that folks are in, that children are receiving care. And it says seeking employment, but it really is just employment. So the majority of our families, the family is working. We've got pretty small amounts for developmental needs or child welfare, child protective services. And by child protective services, for us, that means they're able to, by accessing subsidy, it means that family, that child's not going to have to go into foster care. It's addressing some sort of need there because of something that's happening in that family. So I was talking about 200% of federal poverty is what is our eligibility. We are paying reimbursement rates based on our 2015 market rate study. And in 80 counties, we're paying at the 100th percentile of the 2015 market rate study. And in the other 20, we're paying at the 75th percentile, which is kind of more typical. So, again, these are decisions, though, that are made either, by you, by the General Assembly, by advocates as to what kind of reimbursement are we going to do, and what does that then say about our commitment to covering the costs, especially the cost of quality. Now, you may be at the 50% of the 75th percentile, but then you do the tiered reimbursement on top of that. Yes. And again, so what I'm talking about is it's within so that 100th percentile is what is the highest rate for a 5-star program. That's what they get reimbursed. Also the same for a 4-star or a 3-star. So you don't get subsidy and then something on top of it. You get a reimbursement. So when, this is kind of this whole who's got the authority, what is your structure? And so, for us, we have oversight for all of these different systems. And so it means if we think we need to do something more to help programs get to pre-K, we can do that because it all falls, but we don't have to go to another agency, another department, another division to get buy-in. I mean, I'm not saying we don't work with partners, but it is a little bit more streamlined because it's the same people who are talking about what we need to be doing to provide these supports. So, how is it that you're making decisions? If you're spread across agencies, is there any issue when you have a leadership change? Well, now in this agency, it's a new leader versus this agency, and all of a sudden the dynamics change. And that's just kind of the reality of how things work. So, we really, again, have this advantage of having all of those within us. Probably our biggest challenge is we have an Office of Early Learning, and it's at the Department of Public Instruction. And really what lives there is our exceptional children, so children with special needs that are 3 and 4, before they get into kindergarten, and the Head Start State Collaboration Office. And so how do we work with them, when they've got just that small piece of what they're doing that would be helpful, for us to be able to work with so we can help support them and vice versa. And I will say that has been a challenge. We've kind of interwoven all of our different programs together. So if you want subsidy, you have to be licensed, and you have to have a 3, 4, or 5-star license. In fact, you can't just be at a 1 or a 2-star. So this was put in law by our General Assembly maybe 8 or 9 years ago, 10 years ago, because they've understood that we want our money to be going and our most at-risk children to be going to these programs that are higher quality. Now, the impact on those children's outcomes, that's part of the conversation here, but it really was just kind of a statement that our state was making, that if we're putting our money in, we want it to go to programs that have met higher levels. So our state pre-K programs all have to be licensed, whether they're operated in a school system, a Head Start, or a community-based program. And they have to be 4 or 5 stars. Now, pre-K has things on top of that, so they have to meet even higher standards. They have to have a licensed teacher. They've got reduced ratios, but they have to start with what we would consider for pre-K the floor, that they have to have 4 or 5 stars. Now, I think 80% of them actually have 5 stars. It's a lot easier to reach that pre-K level if you're already 5 stars. The other thing I would mention, just kind of to think about, is that what we have found with our state pre-K program, that when you have that classroom, especially in the private child care centers, that the quality, you might have one classroom that's pre-K, but we see the quality in all of the classrooms move up. Their teachers are more highly educated, they are paid better, they're not at the same level as what's in the pre-K classroom, but you can just see where it's had that impact across all the programs. But pre-K, nonprofit, for-profit, Head Start, public schools. The other thing I would mention is that we don't have any automatic qualifiers at 4 or 5-star levels. Whether you're Head Start, whether you're the school system, whether you're accredited, you come in just like anybody else and you get evaluated and move up the system. And I mean, I think, you know, there's some advantages to just saying it's an automatic, you know, if you are whichever of those, you're automatically 4 stars or 5 stars. But I also know that we see programs that are Head Start, that are accredited, that are run by the public schools that have some major issues. And so I think that's kind of, again, that balance that you have to decide about as to whether you're going to do an automatic, or not. So this, which is our pretty thing that we created for the preschool development grant, really what it tries to capture is all the things that go around our licensing or our mixed delivery system. And so, you know, whether it is, you know, Head Start, pre-K, regulated, you know, whatever, that we know that if you don't have all of these things that wrap around it, you're not going to have the success that you need. So you're not going to have programs that are at those higher star levels. It's not just about their reimbursement rate. It's what are the other kinds of things that you are doing to help support them. So, you know, at the top, we've got our workforce supports. So we have things like Teach, which is familiar here as well. We have our salary supplements, both wages, which is funded by Smart Start and is at about $6.5 million. And then with our infant toddler quality dollars, we started where we're now paying, and it's around $3 million for infant toddler teacher separate salary supplements. They don't get both, you know, it's one or the other. But what we did with this rewards was, it's this, you know, knowing that our infant toddler teachers are not as educated as our 3- and 4-year-old teachers, and they're not as well paid. These salary supplements and this, using our infant toddler dollars, go to infant toddler teachers that have an associate's or other, you know, degree higher up. So this was a way to really say, how do we keep that you know, highly qualified, educated teacher in that infant toddler classroom? So it was a very targeted support to do that. You know, we have, you know, obviously TA that we do through a statewide network of healthy social behavior specialists and infant toddler specialists. You know, all of that funded, as I said, through our quality dollars from the feds. You know, the other kinds of pieces in here, you know, are really you know, about what are the data systems we have that support what we do, so that we can know what are we making progress? Are there certain areas where there, you know, that we need to put more focus on? And we're really building out our integrated data system to be able to do that better. So, you know, I talked about this already. You know, it is very complicated how we do our system, you know, because it is by county, by age, by star level, and centers or homes. But you know, some of these other things, you know, you may do, you know, there's certainly what was recommended in the CCDBG reauthorization, paying by enrollment instead of by attendance, because you have to think about what are all the things that we can do to remove barriers to programs from wanting to participate in your reimbursement system. You know, there was a lot of concern that we were going to move towards paying by attendance, but, you know, they have their same costs whether, you know, that child is there or not. So we've you know, have been doing enrollment for quite a while. We also pay based on the number of hours that are needed. So if, you know, a parent is in school and they have travel time, you know, then they get care that covers that, you know, or, you know, time to do you know, to do the you know, homework and things that they need. So trying to really be realistic about what families need as well if they're really going to be able to be successful. So what we've seen happen, you know, is, again, as I said, legislation requires programs to have 3 or more stars in order to get subsidy. And 80% of our centers have a 3, 4, or 5-star license. So that's of all licensed programs. And again, kind of how you separate or what you call, you know, it's going to be different here. But these are, whether you have subsidy children or not, 80% have a 3, 4, or 5-star license. Now remember, our system has been in place since 1999. And we had a change in 2008, but not a significant change. And so it is time for us to up the ante on our license, especially when you see how many are there. It's like, you know, kind of when you reach that tipping point, that then becomes time to make a difference, because 70% of them have 4 or 5 stars. So, you know, that's pretty significant, and that's great. I mean, we celebrate that, and the thought of changing our system and having those programs drop, you know, all that you all were talking about, you know, in terms of, well, why was it yesterday I was a 5-star, but now today I'm a 3, you know, is a challenge. 75% of our centers accept subsidy. So, you know, we've got a lot of buy-in from our child care programs around subsidy. Again, you know, I believe it's because they feel like they get reimbursed at a fair rate, so they're willing to participate. So a couple of things that, you know, when you think again about from kind of a fiscal side, how you support programs, we are looking at creating an alternative methodology. We are working with the Center for American Progress and have a group that's been pulled together that is looking at what are the kinds of things that we could do, so it's not based on what the market can bear, it is based on what the actual costs are. You know, the challenge with this is what it costs is obviously much more than what we reimburse. So if we go there, either we need more money or less kids are going to be served. And, you know, that's not a decision that I think our General Assembly would want to do. They're the ones who would have to agree to that. So, you know, how do you do that in a way that you can really pay what those costs are, you know, but again, serve less kids? And so how do you make that argument? We've only had one meeting. We've got another one coming up in a couple of weeks to kind of dive deeper in it. But, you know, when you talk about kind of who's at the table, you know, we have the for-profit folks at the table. We have the nonprofits. We have the school systems to talk about this because, and the representative from the for-profit group said, you know, I'm a little hesitant to talk because when we talk about costs, I need some profit in there. And, you know, that sounds bad to talk, makes me look bad that I'm trying to make profit, but that is our business, is to make profit. And, you know, we said that's fine to, you know, because really nonprofits need to make profit that they're then reinvesting in, you know, improving their program. So now 50% profit, maybe not, but, you know, what's an appropriate profit margin? The other thing that we're looking at in kind of this concept of CQI is that our CC&R contracts have done a lot with preparing programs for having the rating scales done. So they come in maybe, you know, 6 months before and, you know, really work with them. Part of what we're looking at, you know, really is doing our CC&R folks doing true quality improvement plans, and not around any time when they're going to have a rating scale done. You know, it's like if you're having a rating scale done, then no, I'll come afterwards, or I'll come, you know, 6 months later, because that you just get so focused on that piece of it, as opposed to we're doing this, which translates into doing fine on a rating scale. So we're starting on that as we're looking at our contracts that will go into place in July. But I think that'll be a challenge for providers. The other kinds of things we're doing, you know, again, from an infant toddler perspective, is what are the ways that we, again, need to support programs financially, because we know our infants and toddlers are not in as high a quality and they don't have teachers that have that same educational levels. And so we've put in place, as I said, rewards specific for infants and toddler salary supplements. We put in place through TEACH, and I mentioned this, although I actually think it is just for infants and toddlers, a kind of mid-year bonus that if they had a one-year scholarship, you know, they finished their first-year scholarship, if they signed up for, you know, a second scholarship, halfway through that year, they get a check to kind of help keep them moving forward and stay motivated to continue on with those courses. And so, that's been helpful because it acknowledges what it takes to actually be in school and be working and maybe have a second job or a third job, and really knowing that they've made that commitment. The other thing that I would just say, is as you're thinking about revising it, and I will say that a lot of this comes from Peggy Ball, and we just got all these folks in North Carolina, and then they go on to do all these other great things. But it used to be I would go out to other states because they'd want to hear about our system, and they'd want to do North Carolina's QRIS. It's like, you can't do that. I mean, you have to look at where you are and what works for your own state. So when I talk about how we do our money, or how our structure is set up that may be different from yours, then it is trying to think about, well, what would it take for us to get there? And could we do baby steps, or have that 5-year goal to be able to reach that? And I think that's really important. And I think it's also, when we make changes, is to make it something that providers can actually meet. You would not want to go to changing, so our 5-star now is at these higher levels, but nobody's there. So you've got to, we just don't want, we would rather have a bell curve right now than where we are right now, where everybody's basically at that 4- and 5-star level. Make it something you can administer. Make it multi-level, make it understandable. When you talk about IT and staff, I mean, so our former director, Dr. Deb Cassidy, she and I were like kind of going back and forth about should we make a 6-star or a 5-star or a 5-star plus as we, if we were going to change things. And I'm like, we got to stay 5 stars. Our system, our IT is all set up. Our license has 5 stars in that template. So the other thing that we are looking at doing, and it's something to think about, is because we haven't been able to yet go to improving what's within our standards, is we are putting forth, trying to find legislators who'd be interested in something that would give a bonus on top of whatever their regular subsidy payment is, that if all of their teachers have a degree, because I said at our 5-star level it's 75% have that degree, but if all of the teachers have a degree and they are paying on a salary scale, they'll get an extra $100 per kid, $200 per kid. We don't know the dollar amount yet, but if they all have associates, maybe you get one amount, and if you all have bachelors, then you get another amount. And so it's the, so we can't quite go to changing our stars, but how do we do a 5-star plus in another way? So how do you get creative? And then when you have enough people at that level, you can say, well, now we can change, the system, and we already know programs are there, and it's not a big deal. So, those are some of the kinds of things that you might want to think about.